Nigeria are on the rise, going by the figures from the National Center for Disease Control, NCDC. Latest figures from the center puts the total number of coronavirus cases at 101. The NCDC gave the breakdown of the recent 14 cases of COVID-19 reported in Nigeria, with 9 in Lagos, 5 in the FCT, and still with 1 confirmed death in Nigeria. The breakdown by state show Lagos with 68, the FCT 21, Ogun 3, Enugu, Bauchi, Edo, Osun states with 2 cases each, while Ekiti, Rivers, Benue, and Kaduna states all have 1 cases each, the total to 111. Now, the Nigeria Center for Disease Control seem to have their jobs cut out for them, as the body is currently contact tracing a number of people. The Director General of the Center for Disease Control, Dr. Chikwe Hekwazu, who was our guest on our breakfast program, Sunrise Daily, also says this period calls for a lot of sacrifice on the part of Nigerians as the stay-at-home order and social distancing rule.
The principles of care, really, for COVID-19 is to maintain respiratory function as the body recovers. Now, you would have seen and noticed that most of our cases so far have been mild to moderate. We've been fairly lucky not to have had too many severe cases. We unfortunately have had 1 fatality. Our target is to get out results in 12 hours. We're not there yet for every result. We get many of them out in 12 hours, but we're not there yet, because what we can do is sometimes there's a positive, it's borderline, we make a decision to repeat. So we have released a new case definition yesterday, defining exactly who needs to be tested. We will apply this strictly so that as long as we don't have the number of tests that we need, which is the reality at the moment, we're working very hard to increase that. But as long as we have these limitations, we have to focus on those who need it the most. At the same time, work very hard to increase the capacity of our testing, which is what we're doing day and night, and we're really assuring Nigerians through different pathways. There are new test technologies that have just been approved. We've already started the procurement process for that. They should be in the country in the next couple of weeks. So that will then that will really radically increase the throughput that we can have for testing. But at the moment, we are where we are. We will increase the capacity of the facilities we have, and therefore make sure that we are able to offer everyone that needs it the test. But we need Nigerians to work with us.
Now, outside Nigeria, according to a Detroit news outlet, a 25-year-old Western Michigan University student from Detroit died on Saturday after contracting the coronavirus. The Nigerian student, Bassi Offiong, was expected to graduate with a chemical engineering degree in a few weeks. His sister, Asari Offiong, said her brother told her he was turned down several times for the coronavirus test in the Kalamazoo area while leaving off campus despite having fever, fatigue and shortness of breath. According to her, 1 medical staffer told him he had bronchitis and they refused to test him. She said he had no known prior health issues. She, however, didn't disclose the locations where he was denied a test. He was later hospitalized at Beaumont in Royal Oak and spent the last week on a ventilator in their intensive care unit. She said her brother's dream was to start his own organic makeup line with L'Oreal, and that would enhance women's beauty. He was a graduate of Renaissance High School in Detroit. In the meantime, the Western Michigan University president said that Mr. Offiong had enormous potential, and also announced that 3 students in the university had tested positive for the virus. The National Agency for Food and Drug Administration and Control, NAFDAC, they've ordered the manufacturing of chloroquine for emergency stock for possible clinical trial treatment of COVID-19. According to the Director General of the agency, NAFDAC is giving expedited provisional approvals for the manufacture of any commodities for preventing the contraction of the disease, like sanitizers and drug or medical devices that could be used for the clinical trial testing and treatment of the COVID-19 pandemic. NAFDAC is also advising the public to desist from its use without the guidance of a medical doctor or clinician for cases of clinical trial treatment. In the meantime, Nigeria's president broke his silence on the novel coronavirus outbreak in the country with a first major broadcast to Nigerians on government's action to containing the spread. President Muhammadu Buhari announced a lockdown of the Federal Capital Territory, Abuja, the commercial city of Lagos, and neighboring Ogun State for the next 14 days to begin tonight. Some of the highlights of the president's message to Nigerians include the redeployment of port health workers to join other medical officials, 3-month moratorium for SIP beneficiaries, 2-month food supply for internally displaced persons, conversion of the federal government stadiums to isolation centers, and restriction of movement of private jets. The decision sets a new tone to the government's fight against the dreaded COVID-19.
Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the two states. All citizens in these areas are to stay in their homes. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states. This order does not apply to hospitals and all related medical establishments, as well as organizations in healthcare-related manufacturing and distribution. Further, commercial establishments such as A, food processing, distribution and retail companies, B, petroleum distribution and retail entities, C, power generation, transmission and distribution companies, and D, private security companies.
Nigeria's President Muhammadu Buhari. Now, with the president's declaration, many Nigerians, especially those who live in the Federal Capital Territory, Abuja, Lagos and Ogun State, may have to spend their Easter celebrations at home. The Minister of Health, Dr. Osage Hanire, in our political program, says it is a sacrifice that is needed considering the exigency of the health emergency in the country.
It's a very good thing to do, that to spend Easter at home and be able to be with the family. Probably it's downtime from work for some people. But on the whole, as I said, if it's a sacrifice for some people, it is well worth it. The country requires really to have most of the citizens in Lagos and Abuja to be in their homes, and Ogun State also, in order to reduce the risk, because there is clear evidence that the more people mingle together, the larger the crowds, the denser the crowd, the higher the risk of transmission of this disease. We have seen that in various other countries. And we have also seen measures that other countries applied in order to be able to tackle this outbreak in their own places. So that is a very good and worthwhile sacrifice if you have to spend Easter where you hadn't planned to spend it.
Last, the Chief of Staff to the President, Mr. Abba Kyari, has spoken about his health status following a coronavirus test, which he has now personally confirmed that he tested positive for. The President's aide in his statement says, based on medical advice, he will be transferred to Lagos today for additional tests and observation after testing positive for the disease last week, thereafter self-isolating. Mr. Kyari says he will be getting treatment at his own expense in order not to burden the public health system, although he claims he has not experienced high fever or any other symptoms associated with the coronavirus. The President's Chief of Staff adds that he has been working from home since he tested positive, but hopes to return to his desk soon, assuring that he has colleagues as backup who are young, professional, knowledgeable, and patriotic, working 7 days a week to serve the president and the people of Nigeria. We have our correspondent who's around the Yaba Center for Infectious Diseases here in Lagos, Yomi Otaigbe. Yomi, please tell us, since you got there, what have you observed, especially the number of confirmed cases in Lagos? We're looking at 68. Can you tell us if there's enough capacity there or if some of them have been moved to other isolation centers?
Thank you, Millicent. I'm right here at the Mainland Infectious Disease Hospital in Yaba, Lagos, where the over 60 coronavirus patients are being treated here. Last month, the Commissioner for Health, Professor Akinbayomi, had said that this center can accommodate at least 80 patients. But our cameras are not allowed inside the hospital. But I was inside earlier to see how things are going, and I saw a number of healthcare workers who are on the front line, taking care of patients, some of them talking to people who have concerns about their status. I saw a couple of people, about 20 of them, coming in to check for, their status, to know whether they have the virus within them. Right now, even though this hospital can take 80 people, the Lagos State government has also set up another 110-bed isolation facility at the Onikan Stadium. And so if this place is full, then, and we have more cases, the other people can be taken to that side. So if we talk about, the preparations for receiving patients and taking care of them, we should also not forget that tonight at 11 p.m., the total lockdown announced by President Muhammadu Buhari yesterday will take effect in Lagos and, of course, the Federal Capital Territory and Ogun State. So what all Nigerians need to do now is to be on board. The Nigeria Center for Disease Control had said that for Nigeria, for the country to flatten the curve of COVID-19 in the country, all Nigerians must be on deck. We all must put our hands on deck to ensure that this coronavirus, is taken out of Nigeria completely and the spread is curtailed.
Losing you at that later end, but we'd like to thank you, Yomi Otaigbe, for us there in Yaba in Lagos. Another question I'm sure in the minds of a lot of people is how many more will we see of these cases leaving the isolation center, and that's hoping that they test negative as well. We have a doctor to look closely at that. Still to come also on the program, it's excitement in Wuhan, where the first outbreak was recorded. We hear shopping malls and businesses have reopened. Do join us again.